Hello, I'm Knox County Mayor Glenn Jacobs. September is National Suicide Prevention Awareness Month. I'm being joined by Matt Schaefer, who is the CEO of Children's Hospital. And when we think of suicide, we normally think of adults. We don't think of kids and teenagers. But unfortunately, we're seeing that problem more and more among younger people, correct?
Yeah, you're absolutely right. It's not just a Knox County or Tennessee thing. Children's Hospital Association, which is a consortium of almost 250 children's hospitals across the state, has seen a more than 60% increase in children who are seeking behavioral health and mental health care in moments of crisis. So it's certainly something we're dealing with every day.
You all just opened up a new unit at the hospital, the McNabb Crisis Stabilization Unit. Can you tell us about that, please?
Yeah, part of what we have been trying to figure out is how do we get to children as quickly as possible when they are in crisis, when they're worried about themselves, where they've talked about harming themselves or others. And rather than those children arriving to our ER, more than 1,600 kids last year in that scenario, rather than them sitting there in an emergency setting where we're really focused on medical and surgical needs, how do we transition them to a therapeutic environment? And that's what the Crisis Stabilization Unit allows. Quick assessment, placement within the unit, and then ongoing cognitive behavioral therapy by the McNabb Center to help transition those children to an outpatient environment and ongoing care.
What are some of the warning signs that loved ones, parents, even teachers, and other folks that are around young people, what are things that they need to be aware of and looking for?
Well, it's tricky. Some things are very obvious warning signs. You see a change in my behavior that just seems odd. You see me start to be more aggressive or violent, right? And they aren't so subtle in that way. You see me change my diet, right? Things of that nature. There's some other more subtle signs, things where I withdraw from the people that I really love, my family, my friend group, where the things I used to love, no matter what that is, whether it's school or sporting events or religious activities, suddenly those aren't interesting to me. And you start to see both this combination of subtle and not so subtle signs that say, I'm struggling with what's going on and I may need some help.
What are some steps that loved ones can take if they believe that someone that they know might need help?
Well, I think the biggest step is just stay engaged, right? Oftentimes, as I just described, children are finding themselves isolated. So how do you not feel isolated? You have people asking, how was your day? Tell me what's going on, having conversation. I think that's one obvious way. And then asking questions, right? There's always an ability to have a different level of conversation. And when something seems off, how do you make sure you reach out to resources that can help? Whether that's care providers already known and established to you and your family, whether that's mental health providers here in the region, whether that's school counselors, so that those options and resources are available.
Unfortunately, there's a stigma surrounding mental health. How do we break that, and how do we show people that these issues can happen to anyone no matter who you are, and it's nothing to be ashamed of, and really if you need help, it's okay to ask for help. Especially if you're a parent, it's okay to ask for help on behalf of your child.
Yeah, absolutely. Your number one job of a parent, be an advocate for your child, your most prized possession. And I think one of the great things we've done as a society over the past number of years is normalize the conversation around mental health. And what I would say is that we need to place that conversation at the same level we place physical health conversations, because you can't be physically healthy unless you're emotionally and mentally healthy. So I'm glad we have actually accelerated the conversation. Part of what we're doing today is doing just that. You're taking time as the chief executive for Knox County to make sure that this awareness is out and amongst our community. And I think that's a huge step that 5 years ago we might not have been able to say.
So if you were talking to a parent who believes that their child might be in crisis, might need help, what would be the one thing that you'd tell them?
I think there's resources that are available to you, and you're not alone. The resource you can get 24 hours a day, no matter where you are, 855-CRISIS-1. It's access to mobile crisis to be able to help in the moment and determine what the next thing is. And then recently, like the 911 system, there's now the 988 system that has a network of care providers who are there at the ready to be able to manage through, whether it be the child reaching out directly or a family reaching out on their behalf. And these scenarios are hard. They're tough. we're not trained for them necessarily, but there are people who are, and they're willing and able to help.
Well, Matt, thank you so much for everything that East Tennessee Children's Hospital does, both for the physical well-being and health of our kids here in East Tennessee, and also their mental health.
Absolutely. Thanks for having me.